Hi everyone, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we have a very special treat. We're gonna go through a patient journey and follow her along from beginning to end and really understand the changes that come as a result of our beautiful facial rejuvenation procedures and the impact it makes in an individual's self-image and self-confidence. So without further ado, let's break it down. I want to introduce Lisette. She is a 54-year-old executive in the biotech industry. Her major preoperative concerns were those of most people, which she basically felt she no longer looked the way she felt. She no longer looked the way she expected herself to look when she looked in the mirror and when she took photographs, etc. She began to see her youth and beauty start to slip away, and inside is a vibrant, very high-spirited, very confident woman who just simply wanted to bring those two worlds back together. And when we look at Lisette's before photos, you can kind of understand clearly where those changes are coming from. Because as you look at the fundamental changes in the facial shape on the front view, you see that there is a downward depression and descent of the lateral brows, the mid-face, the jawline, and the neck. This creates a more square or rectangular shape, which effectively creates a longer look to the overall face. This absolute change is what makes people feel that they no longer look like themselves, because the entire facial shape is changed. Remember, when we're younger, our facial shape is elevated. We've got that tight, firm jawline, sculpted neck. Our cheeks are up because the mid-facial or the malar fat pads are up over the bones. The lateral brows are up. That entire soft tissue platform is elevated, fundamentally acting like a sling, holding the whole face up. And with age, typically in the late 40s, early 50s, we see a descent in that. And that's the foundation of the facial change, the psychological and anatomical change that we see. The other components that change with age, and we can see this in Lisette's case, is there's an all-around loss of volume in very specific areas like underneath the eyes, above the eyes, the temples start to lose a little bit of volume. Along the jawline, we start to see the volume diminish as well. And this also creates a big change in the contour and softness of the face, gives the face basically a more discoherent or broken appearance when you're talking about subunit anatomy and balance. The other area that you can see in Lisette's case, although subtle, is a little bit of extra skin along her upper eyelids. This is a condition called dermatochalasis, where extra skin begins to form in that particular area. And when you look at this entire combination of changes, what you see is that Lisette has an aged appearance. And when you flip to the profile view, you can see that the loss of contour in her neck and the presence of jowls along the jawline make the face look significantly old. And as a result of that, it creates an appearance that, especially when you're vibrant and healthy, just simply doesn't match. And that is the underlying reason why I would say 99.99% of the patients who come to see me are coming to is because they want a balanced outcome that makes them look the way they feel. And that's a hard thing to swallow, especially when you're in your 50s and you know, God willing, you've got a lot of years ahead of you and this is only gonna get worse. So you can understand the psychological underpinnings of these decisions, and that's what it comes down to. Now, my proposal for Lisette and every patient is that we look at this comprehensively. We understand that the balance of youth exists between facial shape and young-looking skin. So those are the two sort of main things that make people look as young as they feel. So we're gonna fundamentally address both of these areas, as we always do. So my proposal was we do a vertical restore to lift the neck, the jawline, the mid-face, and the lateral brow back up into position, improve the contour of the neck and the overall shape of the face, get that more heart-shaped or upside-down triangular look as opposed to the flip view, which is like a right side up triangle where the base is big and the top part of the triangle is narrow, and that's what happens with age. So we were going to achieve that with the vertical restore. We're going to replace some of the volume that she's lost in subtle ways in the areas that I just mentioned, all throughout the face, and just a little very gentle augmentation. And then take away a little bit of that upper eyelid skin to open up that upper eyelid crease, which creates a more refreshed look. When you put it all together, you see magic. This is her before and after. You can see it side by side. This is her at 4 months. Beautiful, beautiful transformation. Very, very natural. And really at the end of the day, one of the critical aspects of a good outcome is that it looks normal. She looks like a normal human being, just a younger version of herself, which is so important. Now, when you examine the outcome, beautiful shape has been restored, jawline is back where it needs to be, and all around we have what we would say is an extremely successful outcome. And now we're gonna take a listen to Lisette and I sitting together at her post-operative visit, and we're gonna kind of break this whole thing down. So let's take a look and see what Lisette and I talk about at her visit. All right, so we are so lucky today to have Lisette coming all the way from Florida, 4 months after your procedure. Let's kind of break it down a little bit. Lisette, you're 54 years old. So what were your main concerns before surgery?
My main concern was my neck, because I was like I feel like really old about my neck and insecure about it. So that was my main concern.
So it's amazing. Lisette is, a super young spirit, right? I mean,
yes, I'm a runner.
You work out a lot. You're in great shape. And when I interact with you, I literally see this is the Lisette that I expect to see. And when you look at the before photos, you're like, that doesn't match the person enough. Yeah. Is that kind of your motivation, yes, or the feeling that you have?
It is like I feel so young in my inside. It's like I work out every day. It's like I run. I am very active. So I felt like my appearance was from 60 years old or even more. So it was like unfair.
Yeah,
so
it is unfair. We're talking about this before, that aging is kind of a cruel thing, because at one point it's a blessing to get older, but at the same time, when you see your youth and beauty just literally slip away at really in a very short period of time, it is a very cruel thing. But it's a beautiful thing that we were able to kind of restore things back to this point. And how does it make you feel at this stage?
I feel grateful that I found you and that I was able to, come here all the way from Orlando and have surgery with you. I feel like grateful. Really grateful.
I love that. I love that. Well, let's take a look carefully at these incisions and things, because we're 4 months out basically, right? So a lot of people want to know, about incisions. So I keep the incisions, as much as I can at the hairline or inside the hairline, and you can see they kind of, you barely can see them at this stage. They go behind the ear into this area. And one of the really important things, as you can see, is the shape of the ear and the earlobe and the tragus and all these things remain the same despite the procedure. And then a segment of it goes behind the ear and into the hairline, which again, you really can't even see at this point. And then of course there's an incision under here. Now in addition, we did, what other procedures did we do in combination? Because that's really important, bringing the whole picture together.
Yes, I thought that my, like I have here, the distance between my nose and my lip, it was really, really long. When I saw you at your Instagram and everything, I looked the procedure there, and I thought to myself, I had to do this, because
the lip lift, huh?
Yes, the lip lift. It was a big change.
Yeah, it looks gorgeous. I mean, you have beautiful lips to begin with, but when you get that distance right, it looks even better. It looks really, really pretty.
Yes, and the day of the surgery, I decided to do my eyes, my upper.
Yeah, because you can't always tell sometimes until we get to see one another, but yes, yeah, the whole picture looks like it blends beautifully together. I love it. Let's take a second actually to review the before and afters here. Let's come on over here. This is what Lisette was talking about, our profile view, the fullness and kind of heaviness of the neck. And this obviously is now today. I mean, it just looks absolutely gorgeous. So nice. And then you look at it on the different views, 3/4 view. This is the person that's sitting in front of us. This is exactly how I picture her when we interact with one another. And you look at this, and this is the distance she's referring to in the upper lip, the squareness of the jawline, and everything just coming up so beautifully. Eyes look fantastic. I could not be happier. My pleasure. Oh, thank you. Thank you for coming today, by the way.
My pleasure.
I love it. All right, thanks so much. That was absolutely wonderful. And now, as you can see, Lisette is several months out. She sent me these beautiful photos of her at roughly 6 months after her procedure, looking gorgeous, looking confident, looking vibrant, looking high-spirited. This is the type of thing that we love to see after these procedures. Could not be more happy for Lisette. She's taking great care of her skin as well. Sun protection is an absolute must. She's on the Karam MD trifecta, which is an incredibly important part of her daily routine to get her skin looking better and better as time goes on. And ultimately, she's going to be able to enjoy these beautiful outcomes for years and years to come without the worry that she's going to continue to age further and further. And that psychological freedom is probably one of the best things that come as a result of the surgery, that liberation of sense of self and concern and just being able to enjoy life as you had prior to these aging changes. Guys, I hope you enjoyed this process. Hope you enjoyed Lisette's journey. Could not be more grateful for Lisette for sharing her experiences with us. If you have any questions at all, drop them in the comments below. Hit subscribe to follow along for more educational content on facial rejuvenation and skin rejuvenation. Share and like and send this along to friends and family. Get them in the know so everyone gets to know what's possible in this particular realm. Folks, thanks so much. Dr. Amir Karam.